morning, everyone. Yeah, I'm Lucy Hooper, work as a research and innovation lead at Health Innovation Kent Surrey Sussex, and also lead on the ARC KSS knowledge mobilisation and evidence synthesis work streams. And I'm also part of the steering group for the HCP internships. So we thought it would be helpful today for me just to tell you a little bit about who Health Innovation KSS is, a little bit about the team I sit in, which is translational research, and some of our work programs as well, and some of the resources that we have that you can access. So Health Innovation Kent Surrey Sussex is one of 15 networks across England. So we're predominantly funded by NHS England and the Office for Life Sciences, and we kind of coin ourselves as the innovation arm of the NHS. So we support innovators and embed innovations within the region, but also work across the wider network as well. So we've got a focus around scale and spread, and we often do that through connecting with our peers across the network. So I suppose the premise of what we do is around finding potential innovations that will address areas of unmet need in terms of our local region, and then support innovation and innovators to test those within kind of smaller scale settings with the view to then scale them and adopt them more widely. So kind of throughout the whole pathway. And as I've mentioned, we have a national commission, or three strands of national commission. So the Accelerated Access Collaborative, and that's to generate a pipeline of evidence-based innovation and support adoption and spread across the system in England. Then we have the Office for Life Sciences, so that's around identifying needs and communicating regional priorities and supporting innovators. And then also doing the kind of real world testing to validate innovation to then scale them more widely. And we're also funded through the NHS in terms of their National Patient Safety Collaborative around managing deterioration, mental health, learning disabilities and autism, medicine safety, system safety, and we've got a key programme around maternity and neonatal safety as well. We also have local commissions, so that's kind of bespoke commissions within the region. So we work across commercial, VCSEs and academic partners as well, often taking a collaborative approach to the work that we do, thinking of multiple perspectives to support projects in response to local priorities, as well as working with which were 3, but now 2 integrated care boards within the region. So we work closely with them to understand what the needs of the population are and develop programmes and projects that will support population health, tackle inequalities, but also ensure that these enhance productivity and support economic growth, as well as considering wider workforce needs and system factors to help improve the NHS in terms of a workplace, so supporting it to be the best place to work as the ambition. So that's a bit about the organisation. So I'm just going to do a bit of a deeper dive into my team, which I sit in. So it's called the Translational Research Team, and not all health innovation networks have one of these, but we do. So yeah, this is our kind of organogram. So I've got myself, Mary-Anne Faroux, who's our Chief Medical Officer, and she's the ARC implementation lead. The Associate Director for the team is Becca Randall. And we have Claire Austin, who works closely with the ARC on the primary and community health services and mental health work streams. And we've got 2 research assistants, Jenny and Eleanor. We also have someone who will be joining the team, or who has just joined the team, actually, Nigel, and he's our strategic partnerships lead. So that's to bridge the gap between academia and industry, including pharma. And we also have out at the moment for recruitment a head of evaluation role. So we're looking to expand the function to include evaluation within the team as well. So yeah, we have 6 strategic objectives. So the first being a trusted partner for research-driven innovation. The second around accelerating the adoption of evidence-based care. through various mechanisms, supporting regional economic growth, building organisational and workforce capability, so thinking about how we can improve the way we do research and support the workforce, advancing research with a focus on health equity, and more recently around growing international partnerships as well. So what can we learn from international partners and other countries? So I'll just mention a few of our programmes. As Beth mentioned, knowledge mobilisation being the key one, which I think would be of interest to yourselves. So knowledge mobilisation is a key theme now across all of the arcs, and I guess it's changed terminology. It was implementation, but knowledge mobilisation kind of captures wider factors as well. So what we know is that research can impact the outcomes of people receiving health and care services, but very few findings from clinical trials actually become standard of care and take up to 17 years, or on average 17 years, to actually make it into practice. And up to 40% of patients don't get treated using the best evidence. So the knowledge mobilisation programme kind of seeks to address these discrepancies through driving research to have the best impact it can have. So it's not about just doing one thing, but really thinking about the wider system in terms of what's happening in the organisation, what's the culture, what are the mechanisms, what's the data showing you in terms of where the inequalities are most pronounced, and looking at what's working well internally, but also externally. So looking at good practice, what can we learn from that, but working with patients, with communities, with the workforce as well, to understand how can this research best resonate with the different groups, and what's needed to really implement the research and have the biggest impact, and then continuously learning from that as well. So not just plopping it in and then leaving it, but continually kind of understanding what's working well, what's not, what needs to be tweaked. So it's kind of more of a broader approach that thinks more holistically about how to embed research into practice, and has kind of communication as a key theme as well. So how do you need to best communicate with those different audiences? Is it about having a community of practice? Is it about having health information resources, developing patient videos? So a whole plethora really of mechanisms. So in terms of you doing your own research and you're not getting much traction in terms of embedding it, and you'd like to know more about knowledge mobilisation and different strategies you could employ, then yeah, please get in touch with me, and we can support you in terms of thinking through different strategies. So yeah, I'll just go on to a couple of other programmes just to highlight the kinds of work that we do. So the the Mental Health Digital Innovation Programme, also known as the UK Mental Health Goals Programme. This has really been, it's a national programme, and it sets out to understand how can mental health innovations be successfully embedded within trusts. So we want to understand what works well, what the barriers are, and I suppose, yeah, what the key facets are to successfully embed mental health innovations in the hospital settings, and really then use that as a case example to think about how innovation in general can more successfully be embedded within the health and care system. So this is a new programme that just launched in April, and it'll be running for a few years. And yeah, so that's kind of one of the programmes we're just involved with recently. And we've also just wrapped up a project exploring neurodiversity in youth offending and how innovations can best support this population group. So it's really understanding, that they're coming from a place of challenge and disadvantage, but also coupled with neurodiversity on top of it in a criminal justice setting. So how can we best support this vulnerable population group in terms of the innovations that we can develop and employ within those settings? So that's been, yeah, a really successful project. We had a webinar where 170 stakeholders attended from the youth justice, healthcare and innovation settings. So yeah, if you're interested again in this kind of work, then please get in touch. And then I'll just touch on a couple of our other kind of resources and programs that we're involved with. So we do quite a bit of work on digital inclusion. We worked with the University of Sussex in developing a digital inclusion framework that has since informed the national NHS digital inclusion framework as well. And we've recently wrapped up a project which was called, or is called EmpowerNet, and that was working with a homeless charity and having digital, I suppose, champions that would provide digital tools and training to support homeless people access services through digital format. So the NHS app, but also social care as well. So through that, we found that they were able to then have an email address, have correspondence, and then be able to access the support that they needed. We do a fair bit of work around user-centered design. So at the moment, we have a project that's looking at neurodivergent young people, and this is about understanding how do they want to be engaged with when developing innovations. So we've developed a set of principles of, if you are an innovator, you want to, and your innovations focused on neurodivergent young people, then we have a guide around how to best undertake that co-production work. And we'll also be looking at doing some other user-centered design projects with different audiences as well. We've recently published some AVT, so ambient voice technology, patient-facing videos. So this was coming out of recognising that ambient voice technology is being used quite a bit already in clinical practice when patients might not be aware that it's being used. So we wanted to create some videos to explain what ambient voice technology is, how it's being used, how it supports the workforce in terms of freeing up time so they can have more personable consultations, yeah, support trusts and clinical settings in terms of helping raise awareness of AVT and also the patient choice around consent, as well as it being used. And finally, we have some health equity resources that are free to access. So one of the programs we've been working on for a few years now is around supporting the workforce who work with unaccompanied asylum-seeking children, migrant families and refugees. And we've developed some principles, resources and some online training as well around intercultural concepts, and also supporting trauma-informed care, vicarious trauma and burnout as well. So if that's of interest, I can put some links in the chat. And then we also have a couple of guides around health equity. So we have a set of 10 principles to support thinking through how to embed health equity in the work that you do. And we've got an innovator guide, which is tailored towards innovators, and also a commissioner's guide as well, which uses the commissioning process and the different kind of health equity domains to think through at the different points of the cycle. So that's just a whistle-stop tour of the kinds of things that we do, and I'll pause for question. I'll put my email in the chat as well if you want to get in touch about any of that work, but that's, like I said, it's a snapshot. It's not all of what we do, but that's, yeah, what the kind of current and what I think are the interesting projects that we've got going on. And I can pop the links to resources as well in the chat if that's helpful. So I'll pause for